I first will start out by introducing myself to my patient. Hi, my name is Kate. I will be your nurse today. Would you please verify your name and date of birth for me?
Nicole Falcon, 5/20 of 93.
All right, thank you. I then would explain my procedure. I would let them know that today I'm going to be giving you an intramuscular shot as well as a subcutaneous shot. I then would close the curtain and perform hand hygiene. Next, I will come over and I will read my MAR. For my IM injection, I will be using a vial. IM is a 20 to 23 gauge, 1 to 1 1/2 inch. And then for my subcutaneous, I will do 25 to 27 gauge in a vial, or I'm sorry, using an ampule, and it is 1/2 to 5/8. I then will go over and do my subcutaneous shots. My subcutaneous shots, you can do it in the vastus lateralis. You can do it in the abdomen 2 inches from the umbilicus. You can do it on the fat pads behind the shoulders or underneath the shoulders, the lower back, and then behind the arms. For IM, you could do the deltoid and the acromion process. Put your hand down and then right here. You could also do the ventrogluteal, and you will do that by asking, will you go ahead and move your leg so I can find the greater trochanter? Okay, you will put your hand on the greater trochanter and find the iliac crest, and then you would do your shot right here. Next, I will do the dorsal gluteal, and you will do that by finding the ischial spine and then also the greater trochanter. Could you move your leg for me, please? Okay, and that is right there. And then the other one is the vastus lateralis. You will find the greater trochanter again, and then also the patella, and you will do it on this outside part right about here. Okay. Now I will draw up my solution. First, I will do my intramuscular, which calls for 1.8 milliliters of NS IM using a vial. So I first will safely remove the cap. And I will withdraw 1.8 milliliters, put 1.8 milliliters of air. I then would also, I would check my vial and I would make sure that it had the right expiration date, and I would also, I would clean it with an alcohol swab. Then I will go ahead and I will inject, and I will put the air back into the vial. I then will turn it up, and I will put 1.8. Solution in my syringe. Okay. I then will remove it and recap. Next, I will do my SQ, my subcutaneous. In my subcutaneous, I will be using an ampule. With my ampule, I will make sure that all the solution is in the bottom. And I will use an alcohol prep to break the neck. And I will be using a filter for my ampule. And I will take out 0.5 milliliters out of my ampule. Okay. And then I will change out and put my needle. So I will put this. Okay. Now I will go ahead and put on gloves. And first, I will give my IM injection. So I will loosen the cap. Which I fastened it too tight and I can't get it out. So I will find my patient's site with my non-dominant hand, and I will clean the site. And since it is a intramuscular, I will make sure to spread out the skin. And since I recap this, I won't be able, but I would put it in at a 90-degree angle using a dart-like motion, and then I will inject, and I will take out. I will apply pressure, and I will dispose in my shots container. So that completes the IM. So now I will do my sub-Q shot. Well, first I would loosen the cap. And I will clean my patient's skin again, and with the sub-Q, I will squeeze the skin. And with this one, I would go at a 45 to 90 degree angle with a dart-like motion. And then I would inject, and I would remove, applying pressure and putting in the sharps container. I then would remove my gloves, and I would perform hand hygiene. Now I will document and I will make sure to record the places that I did my injections. And I will sign. And that completes